Anju is a lead transplant dietitian at the J.C. Walter Junior Transplant Center at Houston Methodist. She specializes in supporting patients with complex nutritional needs before and after transplantation. Working closely with multidisciplinary teams, she provides personalized nutrition care and education, helping patients and caregivers manage their health and optimize outcomes through practical, accessible dietary strategies.
You've had a lot of experts talking to y'all today about treatment strategies, timelines, as to what your options are, et cetera. And so I'm going to be talking to you about what you need to be doing to optimizing your nutritional status in order to make all this possible for you. So, why is it so vital for you to go ahead and look at what your nutritional status is? Approximately 40% of people living with cancer and more than 60% of people living with liver disease have malnutrition. So it is all the more vital that you definitely focus on this. It does affect how you cope. And as you are waiting and going through your treatment plan, we also want you to respond better to the treatment that you are choosing. All of that definitely is impacted by your nutritional status. Loss of appetite, your taste changes, reduced intake due to chronic pain or acute pain, moods, a sense of fatigue, all of these are going to be something that's impacting you based on your disease condition. But your treatment strategies that you have chosen can also play a role in changing some of these things for you. And therefore, now you're fighting on two ends, trying to figure out how best to cope with what you're eating at home, how you are trying to deal with the fatigue that you're dealing with, the tiredness that you're dealing with, the mood swings, any GI discomfort that you're feeling, etc. Maintaining a normal weight, for many people, early symptoms of your disease condition can include symptoms of pain. It can have the nausea, the loss of appetite, even before you come in to see your physician about it. So you're already coming in at an declining nutritional status, and then we are working harder to try and see if we can optimize you. So this is where you working with your team, and here I cannot emphasize the importance of why it's so important for you to consider your specific team, whichever hospital clinic that you're seeing. They may have slightly different recommendations than what I am going to be talking about here. There might be some things that they're willing to trial. There might be other things that they are probably not going to be willing to trial. So you need to think about that. Just include them in your discussion so that you know what you're talking about. But we definitely want you to be eating a balanced diet. We want you to focus on maintaining a normal weight if that's the range that you are currently at. If you are overweight, if you are considering some elective muscle loss, and it is going to help sometimes in the case of your treatment plan, but if you are dealing with cancer at this point of time, you don't want unintentional weight loss. Anytime that you have a weight loss, whether it's intentional or unintentional, there is going to be muscle loss associated with it. So therefore, optimizing and focusing on how you're directing your attention to what you're eating, what your plate looks like, becomes very important. So we want you to focus on protein options. We want adequate calories there. We want you to work on trying to prevent unintentional weight loss. And we want you to work with the medical team to try and see how you can improve your muscle strength and your muscle function if that is becoming an issue for you. So aim for the macronutrients. We are talking about protein, we are talking about carbohydrates, we are talking about fat intake here, and choose those widely. We always talk about choosing a wide variety of foods when you're undergoing treatment. It's always a good idea to have that wide variety. If you have a very narrow selection and you suddenly develop aversion to certain foods, then you become much more restricted. And that's why you kind of hear or read about this choose a wide variety of foods. No, I mean, you just need to be able to find alternate options. Your plate should include adequate amount of calories. in order for you to maintain your weight, in order for you to maintain muscle strength. But you have to be thoughtful and mindful about how you're approaching this. There might be days that you don't feel hungry, you don't feel like eating, but you still have to go through it. There is no option because you have a treatment plan, you have a whole support team of physicians and surgeons who are working with you. And so we appreciate the fact that you are putting that effort in, where you are choosing 3 healthy meals, you're choosing healthy snacks. And when I say snacks, we are not talking about chips and cookies, of course. I'm thinking about Greek yogurt, think about cottage cheese, think about where your protein is coming from anytime you're planning a meal or a snack. Hydration is extremely important as well. It's important to keep your kidneys happy while you're going through all this treatment. You might be taking a lot of medications. It's a good idea to stay hydrated. More is not necessarily better. So when I say hydrated, I'm talking about 6 to 7 cups of water. But if you have liver disease and symptoms associated with that, where you're retaining fluids, then you do need to definitely manage the fluid intake. So again, talking to your team, I cannot emphasize that enough. Um, if your appetite is reduced, focus on energy-rich foods as much as possible. Try to choose the higher protein foods. If you all have kids or grandkids at home, you always know we talk about grow foods with kids. We are trying to make them focus on the protein foods, so they're not eating all the other junk snacks first. And so therefore, the same applies to adults as well. Consider tracking your symptoms along with your weight. You might benefit from having a food tracking log or a food tracking app that you're using. And do consider protein supplements. See if the team is okay with you having it. Talk to your dietitian about it. Um, Choosing lean meats, reduce the processed foods in your diet, choose fresher cuts of meat. Um, Shop the perimeter of the store, if you've heard the term, which means you're shopping along the outer walls. Most grocery stores here in the US are designed the same way. You're entering usually to the right or to the left is where you start, and you're going to be starting with the fresh vegetables, the fruits, go to the deli section, pick up the less processed meats. The back wall is usually dairy, your eggs, your cheese, your Greek yogurts. Come through the frozen aisle, pick up your frozen vegetables and frozen fruits, and you're ready to leave the store. If you are going to be stopping in the in-between aisles, then I strongly encourage you to start reading labels. If you're picking up apples and carrots to bring home, there are no labels to read. So definitely want you to focus on that. Do consider eggs, milk, cheese, Greek yogurt as protein sources, as are beans, lentils, tofu, which is a bean curd that is used to make amazing Thai food. If you're into ethnic foods, definitely consider all those on your plate. And so I'm talking about like trying to be a little bit more creative. If you have apple slices, try to add a tablespoon of peanut butter on the side, sprinkle some chia seeds. You're increasing some protein, but you're getting some fruit. Fruits are part of our diet. Juices do not have to be part of our diet. So I will say, especially if you have diabetes, you can drop the juices. Try to focus on what you're able to eat. It might be small meals. You might have to do multiple small meals per day, and that's what you really want to focus on. So now we go on to some symptoms that you might be feeling. If you're undergoing any kind of treatment, chemo especially, you might end up with some dry mouth symptoms. And that's something that you need to cope with hydration initially. So again, 6 to 8 cups of water is going to be helping you. If, like me, you struggle with fluid intake, filling a water bottle, and I do see a lot of people here, smart people with water bottles in front of them, that's how you remind yourself to drink your water. Change the temperature of the fluids that you're drinking. If you do have a sore mouth, icy cold fluids or very hot liquids may not be appreciated. And therefore, I think you need to switch to room temperature fluids if possible. Check your tolerance for spices. High salt, high spicy foods may also not be tolerated if you have sore mouth. So definitely work on that. Your team can again recommend a magic mouthwash or miracle mouthwash if you really have a sore mouth. Most of these tend to have like an antifungal medication in the solution, along with some kind of steroid solution. Some pharmacists will add lidocaine to numb your mouth a little bit. These are all swish and spit. You don't rinse immediately afterwards. Don't eat or drink anything for 30 minutes. The other thing I also suggest is if you have like an off taste that's affecting your appetite, um, a plain and simple baking soda mixed in a little bit of water, something that you can again swish and spit right before your meals can usually help you with that. Talk to your dietitian again. Nausea. I know we just finished lunch, but I have to go into these GI symptoms. So, coping with nausea again, it takes a little bit of planning. Most people with liver disease do experience this, but the more you ignore it, it actually worsens. And therefore, the symptoms have to be something that you have to address early on. An empty stomach is usually going to cause nausea. The less food that you're taking in, you end up exacerbating the issue. Dry crackers, dry toast, if you're experiencing morning nausea, seems to help. Trying to separate your liquids from your solid foods will help. Also, I would say that when it comes to any gas, bloating, try ginger tea, fresh slices of ginger, which is boiled in hot water. You decant it. Once you cool the liquid, you can sip on it. You can add honey to it or a small splash of lemon, and that's going to sometimes help with the nausea. I'm trying to find non-food ways for you to cope with so that we are not adding a pill burden to the already larger amount of medications that you guys are having. And then cumin can also help with this bloated feeling again. So that might be another one that you can try as well. It's cumin, fresh cumin seeds boiled in water. It's an old grandma remedy, but it does work. So you can trial it and see if it's something that you can benefit from. Taste changes again, if it bothers you, changing the temperature sometimes usually seems to help. Steaming hot sometimes actually exacerbates the aroma, and some people that kind of triggers their nausea. So try to have the food prepared and don't come into the kitchen area and then sit down to eat when the temperature of the food has cooled down a little bit. That might help you. Of course, try to make it appetizing. Experiment with spices and fresh garlic, ginger, cumin, lemon, lime, vinegar, etc. Bitter taste, artificial sweeteners tend to actually heighten the bitter taste in some patients, so try to avoid it if you can. Metallic taste, the baking soda tends to help with that. Also, trying to marinate your meats in pineapple juice seems to help with it as well. I do want to say that when it comes to the spices that we are talking about, I'm from India, so I talk about spices all the time. And the thing is that while you're going through this, sometimes I do have patients who come and talk to me about the fact that they are using turmeric pills, that they're using garlic pills, that they're using some kind of liver detox. I'm going to strongly discourage you from doing any of those before or after. I don't want anybody in this room to be trying something that, one, we don't know the efficacy of it. There's very little research done in some of these areas. And just because turmeric kind of works as an anti inflammatory in food doesn't mean more of it is somehow going to be helpful. Putting it in a pill form and having that is not going to be helpful. Also, we have very little kind of supervision in terms of exactly what goes into these supplements, the over-the-counter supplements that are out there, especially the herbal supplements. So I will say definitely dissuade from trying those. And if you are on it, I would say talk to your dietitian about it. Other GI symptoms, diarrhea and constipation. Some people do experience it. We do want to talk about fiber when it comes to this. If you don't have adequate fiber, including uh, fiber gradually into your diet will be helpful. Staying active for some people with constipation, that seems to improve their symptoms. You may have to try a low FODMAP diet. Your dietitian can help you with that. Um, Things that you might hear and again read on Google Doctor is going to be like banana, for example. It can help or hinder. Probiotics can help or hinder. So I want you to be cautious about using it. I'm not a big fan of probiotics. So I will say if you're introducing it gradually, especially in probiotics in the form of in a food form rather than in a capsule form, that would be allowable. But anything else may not be necessarily helpful for you. But I want you to trial, do talk to the dietitian on your team and find out what's going to help you. Small intestinal bacterial overgrowth is a real thing. It does cause a lot of flatulence. It does cause bloating for some people. It's extremely uncomfortable. And so here again, our gut microbiome, we have like trillions of microorganisms in our gut. It plays a crucial role in maintaining our health, and it balances our gut, and it is essential for our good digestion. It's for nutrient absorption and immune function. But here again, probiotics are the first thing that come to mind. You're going to read about it. It may help or hinder. So I would say definitely, again, talking to your team about it. But fiber, if you're not having fiber, including fiber, if you're having too much fiber, reducing the fiber, adequate hydration, physical activity is going to help. Fatigue can end up causing loss of appetite. It can cause weight loss in patients, and it automatically causes loss of muscle mass. And in this case, I go back to definitely both the patient and the caregiver to reach out for and have a plan ready. If you have friends and neighbors who are willing to bring in food, if fatigue is preventing you from getting up and cooking, these are things that you can proactively plan for, and definitely want you to consider that. Um, and if it's okay by your oncology team, then and the oncology team is usually the one that kind of moderates. If you're already with the surgical area, then the surgical team is fine with protein supplements. But oncology, sometimes the protein supplements, it does make a difference. And so you definitely need to talk to them if you are going through chemo or radiation. I will say with the protein supplements again, the the trending protein supplements in the market might be Premier Protein, for not to use a brand name, but I'm just calling out a name. It may not necessarily be the one that you as an individual might require. If you are already underweight and if you're losing weight, then that may not be the best option. If there is kidney issues, then that may not be the best option. So again, talking to a dietitian might give you a better idea of other options that you could be considering. So just want to put it out there. If you have had any kind of surgical procedure where you have had to have some kind of surgery on the duct, like a Whipple procedure, etc., then you might need pancreatic enzyme replacement therapy. These digestive enzymes usually have lipase, which is for your fat digestion, your amylase for carbohydrate digestion, and protease for protein digestion. They do come enteric coated, so they are not digested by your stomach acids, but some are non-enteric, and therefore they might be used with acid reducers, proton pump inhibitors. The thing is, the way the dosing, you have to take it in a very specific way for it to do its job. So you cannot crush or break it. It has to be taken with applesauce. You have to take it in a series if you're taking a meal. This again, so it requires, if you are placed on it, definitely talk to the team to figure out exactly how you're supposed to take this. But it plays a very important role. It helps with especially fat digestion for a lot of patients who have gone through a Whipple procedure. So that does include malabsorption. So weight loss, bloating, diarrhea, cramping, abdominal pain, all of these are sometimes signals that your body is not absorbing all of the nutrients. And therefore, if you're having weight loss and you're also having some of these GI symptoms, this might be a good time to, again, reach out to a dietitian to see how you can. Try to avoid high fat foods. Generally, it's not well tolerated. So adding fat calories doesn't usually resolve the problem. So you do need to find like a lower fat option, and your dietitian can help you. Vitamin supplements. So consider multivitamins for sure. That should be okay. If you have liver issues, fat soluble vitamins are affected. Copper, zinc can be affected. If you are on other medications which might be affecting, then selenium, CoQ10, et cetera, might be. So again, this might be an oncology issue that you might need to talk to the team to see what is allowed. But generally, a multivitamin is usually allowed. So consider taking that if you are losing weight, especially you're not eating as well. And that ends mine. If you have any questions.